Feeling overwhelmed or unsure about your mental health care options? Let's break it down. Psychiatric care comes in different levels to meet you where you are. And navigating the world of mental health care can be very overwhelming, especially when it comes to finding the right level of care for your needs. From therapy to inpatient treatment, there's a wide range of options available. But how do you know which one is the best fit? Today, we'll break it all down for you. Hi, I'm Dr. Marie Donna, a youth, adult, and reproductive psychiatrist here to talk about all things mental health and wellness. Understanding the different levels of mental health care is essential to getting the right support at the right time. Let's explore what these levels of care are and when they might be needed. So what's the first level of care? Number one is outpatient care, which would be general psychiatry and/or therapy. This is the most common level of care, and this is where most people begin. It involves meeting with a psychiatrist or therapist regularly, maybe once a month, once a week, for ongoing support for medication management or behavioral interventions like therapy. It's ideal for those managing their mental health while continuing with daily life, like work or school. So who is it for? This is for people experiencing mild to moderate symptoms that don't interfere significantly with daily functioning. Example services would be talk therapy, like individual, group, or family, medication management with a psychiatrist, or skills-based therapy like CBT or DBT. The next step up in a level of care would be intensive outpatient programs or partial hospital programs. These programs provide more frequent care, often a few hours a day, several days out of the week. They're designed for individuals who need more support than outpatient care offers, but don't require 24/7 supervision for safety. You might find group therapy, individual therapy, and skill-building activities in these settings. So IOP, or intensive outpatient, who is this for? This is for an individual who needs more support but can still manage to live at home. Example benefits would be more structured care without disrupting daily life entirely. And this can offer group therapy and skill building sessions. And IOP can involve several sessions throughout the week for a few hours a day. PHP, or partial hospital programs, this is for someone who is needing intensive therapy to manage symptoms that interfere with daily life, but again, not requiring 24/7 care. Example components would be a combination of therapy, medication management, and group activities. It's often used as a transition between inpatient care and outpatient care. Inpatient hospitalization. For severe mental health crises, inpatient hospitalization is the highest level of care. This is a short-term option focused on stabilization, usually for individuals experiencing intense symptoms such as suicidal thoughts or psychosis. Patients receive round-the-clock care, medication adjustments, and therapy in a controlled environment to ensure safety. So who is this for? This is for people in crisis or with severe symptoms who need immediate and intensive support to ensure safety and stabilization. Example situations would be suicidal ideation or suicide attempts, severe depression, mania, or psychosis. So what to actually expect in an inpatient psychiatric hospital? These would be structured days with therapy, group sessions, and medication adjustments. They would also discuss transition planning for when it's safe to step down to lower levels of care. And inpatient hospitalizations range anywhere from as low as a few days to several weeks, depending on how the person is actually doing in the hospital and what brought them in the first place. Another level of care is residential treatment. Residential treatment offers a step down from inpatient care, but it is more immersive than outpatient options. It involves living in a facility to a period of weeks or months to focus intensely on recovery. It's great for those needing extended support for conditions like substance use, eating disorders, or severe mood disorders. Typically, when I will recommend someone to a residential treatment facility, especially the child and adolescent population, it is when someone has been admitted to the hospital several times in an acute inpatient psychiatric hospital a few times out of the year, and they need longer ongoing support for their mental health needs. Emergency and crisis services. And finally, for immediate mental health emergencies, there are crisis services like hotlines, mobile crisis, or emergency room visits. These services are available 24/7 to provide immediate stabilization and connect individuals to the appropriate level of care. So when would you use this service? When someone is at risk of harming themselves or others, or when there are severe withdrawal symptoms of substances like alcohol or drugs, or psychotic episodes. So when should you actually transition between different levels of care? It's important to remember that your needs might change over time. You might start in an outpatient care, transition to IOP or PHP during a tough period, and then return to outpatient care once you have stabilized. The goal is always to meet you where you are and provide the right support at the right time. So how should you actually decide on the right level of care? Factors to consider are severity of symptoms, safety concerns, such as thoughts of harming others or yourself, or ability to function daily, or if that is severely impacted. As a psychiatrist who works in an emergency room setting as well as an outpatient setting, I'm always encouraging others to reach out to help. Remember, you don't decide what level of care you are going for yourself. You will usually touch base with a primary care doctor, a therapist, a psychiatrist, or an emergency room doctor to help with the next appropriate level of care for your mental health needs. And it's also important when you're doing this to be honest about what you're experiencing so that you can be matched with the right and appropriate level of care for you. It can be scary, but just ultimately knowing your safety and well-being is the most important thing when it comes to finding the appropriate care for you. Finding the right level of care can feel like a big step, but remember, you don't have to navigate this alone. Whether you're exploring outpatient therapy or considering more intensive options, the most important thing is to take that first step towards support. If you found this video helpful, check out my other videos on mental health topics, or let me know in the comments what topics you'd like me to cover next. Let's continue learning and growing together. This is Dr. Marie Donna.